My name is Ariana Estrella and I'm going to talk about appendiceal pinworms. In definition, Enterobius vermicularis, commonly known as pinworm or threadworm, is responsible for a widespread parasitic infection estimated to affect up to 209 million people worldwide. Around 4% to 28% of children worldwide are reported to be infected. Infection via the fecal-oral route is the most common route of human transfer.
What is pinworm? It is a small white parasitic worm having length of 2 to 13 mm and lives in the rectum of humans. Female parasites deposit eggs on the skin around the anus during night when the patient is asleep. They can survive in moist environment outside host for up to 18 days. How to check the presence of pinworm? Apply transparent adhesive tape or pinworm paddle on the anus region immediately after awakening. Firmly press over the anal area for few seconds. The pinworm eggs and adult pinworms stick to the tape or paddle and can be viewed under microscope. The other test is the flashlight test. It is carried out immediately after awakening or when a patient wakes up in the midnight due to irritation around the anus area. Apply flashlight around the anus area and examine. Look for any white thread-like moving object around 2 to 13 mm in size. Do these tests for at least 3 days to get any conclusion. How is infection spread? By the ingestion of pinworm eggs. The eggs pass into the intestines where they are converted into the larva. The larva travel to large intestine and live there as a parasite. Symptoms. Symptoms include irritation around anus area during night, tenderness or redness of the skin around anus, restless sleep. Treatment. Contact your doctor for treatment. For knowledge, albendazole and mebendazole are used for the treatment of pinworm infection. Precautions. The child should wash hands and fingernails well before each meal. The child should wash hand after each toilet use. Keep fingernails of child cut short to prevent deposition of worms in nails. The child should leave habit of thumb sucking and nail biting. Rinse and wash anus area thoroughly during bathing. Thoroughly decontaminate all bedding, clothing and toys to destroy eggs. Wash all bedding every week.
An application in medicine, vermicularis infection is usually asymptomatic. The most common symptom is pruritus in the perianal region, but infestation may also present with ileocolitis, enterocutaneous fistula, urinary tract infection, mesenteric abscesses, salpingitis, and appendicitis. The presence of pinworms in the appendix has been shown to cause symptoms mimicking appendicitis or appendiceal colic, but frequently without any histological evidence of acute inflammation. The presence of E. vermicularis is associated with chronic inflammatory infiltrates and eosinophilia.
Hi, I'm Dr. David Hill, and today we're going to talk about how to treat pinworms in kids. Now, the first question is, how do you know your child has pinworms? Some people think that if their child, for example, sleeps with their bottom in the air, they must have pinworms. Well, that's not a very sensitive sign. However, if you see your child scratching at their bottom a lot when they're sleeping, or also, if your child is a girl, she may have some vaginal itching, which is also a result of pinworms. So if she's got bad vaginal itching, think of a yeast infection, but also think of pinworms. If you take a peek, especially at your child's bottom in the middle of the night when they're sleeping, you may actually see the worms. It's really gross, but it is a definitive diagnosis of the pinworms. You see these little bitty white guys crawling around in the bottom. Sometimes you'll see them in the stool when your child uses the bathroom. So if you see those worms, hey, you know exactly what you've got. So you got pinworms. What are you going to do about it? Well, there is a medication that your child can take, and it's given in a pill form, although it is a chewable pill. It's about 100 milligrams, and the child is going to take the medicine once on day one, and then you want to put a little mark on your calendar 14 days later and give a second dose after 14 days. Now, if one member of the family has pinworms, there's an excellent chance that other members of the family also have pinworms. So a lot of people will treat all the family members all at the same time to keep pinworms from being passed back and forth. Now, how do you keep your child from getting pinworms? It's all about the hand washing. This is why we don't like children to eat dirt or things that have fallen on the floor. The 3-second rule or 5-second rule, however you play it in your household, yeah, probably isn't going to protect your child from pinworms, nor is blowing off the food. So what? Pinworms are not the worst disease in the world, but if you're worried about it, that's probably the most important thing you can do. So remember, you can go to your child's doctor for medicine. One pill the day of, one pill 14 days later. Some doctors will call those in based on your description, others will not. You might want to treat the entire family, keep the child's hands clean. Talking about treating pinworms in children, I am Dr. David Hill.
And the pros and cons, the majority of studies report a lower incidence of inflammatory changes in patients with appendiceal pinworms. It is not clear whether the invading organisms actually cause the inflammation or if the parasites are incidental findings in cases where inflammation is already present. Cons. Globally, the reported incidence of ivermicularis in patients with symptoms of appendicitis range from 0.2% to 41.8%. Ivermicularis infestation may cause a clinical picture resembling acute appendicitis by obstructing the lumen or causing a hypersensitive reaction in the tissue.
The appendix is the little one-ended tube that's attached to the cecum of the large intestine. Sometimes it's called the vermiform appendix, where vermiform means worm-shaped, so that should paint a pretty clear picture of what it looks like. And this odd, kind of cute little worm-like structure's function is actually unknown, though some theories suggest that it might be a safe house for gut flora, and some evidence seems to suggest that it plays a part in the lymphatic and immune system. Other, arguably more cynical viewpoints think that it's just a useless vestigial organ from our ancestors. Whatever the case may be, the fact remains that it's pretty talented at getting inflamed and causing abdominal pain, a condition known as appendicitis. As much as 10% of the population develops appendicitis at some point, and it's the most common surgical emergency of the abdomen. Since the appendix is a hollow tube, the most common cause of inflammation is something getting stuck in or obstructing that tube, like a fecalith, which is a hardened lump of fecal matter that finds its way into the lumen of the appendix and wedges itself there. It could also be other things, though, like seeds that weren't digested, or even pinworm infections, which are intestinal parasites. Another cause of the obstruction, especially in children and adolescents, is lymphoid follicle growth, also known as lymphoid hyperplasia. Lymphoid follicles are dense collections of lymphocytes that get to their maximum size in the appendix during adolescence. Sometimes this growth, though, can literally obstruct the tube. Also, when exposed to viral infections like adenovirus, measles, or even immunizations, the immune system ramps up and these follicles can grow as well. Whatever the cause of the obstruction is, now the appendix is plugged up, right? Well, the intestinal lumen, including the appendix, is always secreting mucus and fluids from its mucosa to keep pathogens from entering the bloodstream and also keep the tissue moist. Even when it's plugged, the appendix just keeps secreting as usual. When this happens, fluid and mucus builds up, which increases the pressure in the appendix. And just like when you fill up a water balloon, it gets bigger and physically pushes on the afferent visceral nerve fibers nearby, causing abdominal pain. Along with that, the flora and bacteria in the gut are now trapped, right? And intestinal bacteria that are usually kept in check in the gut, like E. coli and Bacteroides fragilis, are now free to multiply. And this causes the immune system to call up white blood cells, and pus starts to accumulate in the appendix. This activation of the immune system can be seen in the lab as an increase in the serum white blood cell count. Patients might also develop a fever in response to the infection, which in combination with right lower quadrant abdominal pain, at the point roughly where the appendix is, known as the McBurney's point, is a super important sign for identifying appendicitis. Also, along with the fever, other classic symptoms include nausea and vomiting. Now, if that obstruction persists, the pressure in the appendix increases even more. At a certain point, as the pressure keeps going and it continues to swell up, it pushes and compresses the small blood vessels that supply the appendix with blood and oxygen. Without oxygen, the cells in the walls of the appendix become ischemic and eventually die. Since these cells were responsible for secreting mucus and keeping bacteria out, now the growing colony of bacteria can invade the wall of the appendix. As more cells die, the appendiceal wall becomes weaker and weaker, and for a small proportion of patients, it gets weaker to the point where the appendix ruptures. Rupture of an infected appendix allows the bacteria to escape the appendix and get into the peritoneum, and patients often experience peritonitis with rebound tenderness, meaning pain when pressure is taken off, again around the McBurney's point. Patients might also have some abdominal guarding, where the abdominal muscles tense up when pressed to try and avoid pain. The most common complication with a ruptured appendix is pus and fluid getting out and forming an abscess around the appendix, called a paraappendiceal abscess. Sometimes subphrenic abscesses might also form, and these would be tiny abscesses below the diaphragm but above the liver or the spleen. The standard treatment for appendicitis is appendectomy, which is a surgical removal of the appendix along with antibiotics. If patients have abscesses, these are also important to surgically drain. Removing the appendix isn't known to have any negative side effects, and sometimes it's removed if the surgeons are already doing an abdominal surgery for some other reason, just to avoid an appendicitis down the road.
And it's applied in Ecuador. There is a high percentage of patients who are delayed between 25 and 72 hours from the onset of symptoms to the operative act. The most important factors that condition the delay are that the patient is late in going to the health service and that there are difficulties in transferring patients for geographic reasons. Self-medication is one of the most important factors for the complication of appendicitis. In conclusion, the finding of ivermicularis in appendectomy histopathological specimen is a rare incident. Parasitic infections rarely cause a clinical image of acute appendicitis, especially in adults. The surgeon must be aware of parasite infections with appendicitis-like symptoms. Careful examination and symptomatology awareness such as pruritus or eosinophilia in the blood examination and a high level of suspicion might prevent unnecessary appendectomies. Thank you.